My God,
Very good.
320. Is this not a form of testing of something?
Well, good afternoon, everyone. We still have a few people to join us. I think we had over 400 sign up for the town hall today, which to me means there's lots to discuss and lots of questions. And we thank you all for joining us. I'm Sandra Brown, Vice Chancellor for Research here at UC San Diego, and we have several other leaders with us today. And we're going to have two main topics today. The first will be an update on the COVID-19 situation and our plan that is referred to as Return to Learn. This is the campus-wide effort to accelerate testing and assessments that will allow us to come up to full speed as quickly as possible. We're going to spend about the first half hour on that, and we'll have Chip Schooley and David Brenner here to answer any questions that you might have about that. And then we'll move into the research ramp-up plans. I will do a brief overview, and we'd like to have the majority of the last hour deal with questions that you might have about that ramp-up plan. So with that, I'm hoping we have Chip on board, and that he could begin to give us the update for the coronavirus situation now, and then the Return to Learn. Chip, are you there?
I am, thanks. Can you hear me?
Very good, thank you. Okay. Take it away.
Sure, I'm glad to have a chance to share with you a program that has been rapidly evolving over the last several weeks that we hope will make San Diego a place that we can return to learn. And as you can see in a darker corner down there that the branders wouldn't let me use, alerts to research. I want to bring us all back to do all the things we do on campus because all these things we do are ones that are integrated, and the research enterprise is critical. So it's going to be one of the major focuses or foci of getting us back to work. Next slide. Now, people know the epidemiology of this very well. I'm not going to spend time talking about the fact that we're already at 3.5 million cases and rising. Next slide. But I want to spend a little bit of time talking about the US because it's important for us to understand that while we're making plans for coming back in the fall and making plans for coming back in the summer, a lot of what we're doing is in the context of what goes on in the rest of the country. And it's going to be really important for us to realize that both as people who are part of this country, we have to contribute to control, but we also, I think, need to realize that a lot of the plans we're going to have to slide in terms of their scale based on the activity of the virus in the community. This is a CDC map that shows that we're kind of in the plateau zone of coronavirus disease in Southern California. San Diego is, as I'll show you in just a minute, in a place where the virus is kind of cruising along, no longer rising as fast as it was, but not falling as fast as we'd hoped. Next. Now, we've also heard the last few days that things are leveling out in the US, but that's an artifact because the real story is that things in the US are leveling out, but things in New York City and in New Orleans, where the virus has played its way through the population, are falling, and the virus is actually rising in the rest of the US. And we're part of the rest of the US. So we have to be careful about being complacent and saying, we've got this, we can now move on to the next phase, because in fact, we don't have this. And in outside places where the virus has run through a large part of the population, the situation is still not under control. Next. This shows San Diego. You can see here, we're now at about 4,000 cases. We're picking up between 100 and 150 cases a day. We've been doing that for now, off and on, for about 5 weeks. The lower bar of the orange seams are the part of the bars are the positive cases that are new cases as we go along. Some of the new cases are because we're doing more testing, but some of it is because we're continuing to have new cases appear among us, and we really haven't gotten to a part where of the curve where the number of cases is falling rapidly. Next. This shows you a map of San Diego, and as you might expect, the largest number of cases occur in downtown San Diego, where most of the people live. But what we're seeing just south of the border is an evolving human tragedy, with Tijuana being as bad right now as New York City was at its worst, which is terrible for Tijuana. And it's also one of the contributors to the ongoing number of new cases in San Diego. Now, let me be clear, these are not cases of people climbing over the wall or going around the barriers. These are American citizens, for the most part, coming through with passports and visas, coming back from living in Mexico and populating hospitals in the southern part of the city. Many people at UC San Diego, led by Linda Hill and others, are very involved in trying to figure out how to help in Tijuana. It's going to be something that I hope our research community can help in as well, because if we can't solve Tijuana, San Diego is going to continue to be at risk, and Tijuana itself is going to continue to have a lot of morbidity from this disease. Next. Now, this is a graphic that was embedded in a link in the New York Times today from a report that was not supposed to be made public, and data run by Homeland Security. And what it shows is, despite the fact that if you could look where we are now in early May, although it looks like things are plateauing, the internal government projections are that we will continue to see a rise in new cases that's going to extend at least through June. Next. And that the deaths will continue to rise at least through June. So despite the discussions about closing down the task force and moving on to the next phase, even internal government statistics don't suggest that that's where we are. Now, I don't want to be negative here, but I really want to point out that we're talking about coming back to campus and coming back to school in the context of much better control of the epidemic than we have now. So we really need to double down on this. Next. Now, how do we get back? So put that behind us, and let's think it's now back in next June or next September. We want to come back to campus. There are a few cases in the community, and we want to know how to come back in a way that we can teach, do research, do our service work at the lowest possible risk. We know already from our larger society experience that we can't wait to just see cases showing up in our emergency room or in our ICUs, because by that time, virus has been circulating in the community at much higher tempos than we would have thought, because what goes on under the surface is probably greater than what goes on over the surface. And in addition, it takes 2 to 3 weeks for a newly infected person to show up in an intensive care unit. So if we wait in the fall for cases to show up in our hospital, we will have many, many cases on campus that we're unaware of, and it will be very difficult to stop the epidemic on campus by suddenly going in and trying to do a partner notification or exposure notification and quarantine. So Natasha Martin and Victor DiGurtola have done a very good job of modeling, if we decided just to look for viral shedding by sampling either saliva or nasal secretions, how often we would have to test people on campus to have a greater than 90% chance of picking up the first 8 or 10 cases within the first week and a half or so of the virus getting back to the campus. And this is one of the models they ran. And what it shows you is that if we test everybody on campus every month, once a month, we'd have a greater than 90% chance of doing that. And even if we could get to 50% of the people or 60%, we lose a little bit, but we don't really get into trouble until we start getting down into the 25 and 40% range of testing. And when we get there, we'll be in a situation where it'll be impossible to use public health interventions to do anything but shut the campus down. So what we've developed is an approach in partnership with the hospital and many others on campus to offer free testing to students, faculty, and staff on a frequent basis on what we hope will be a labor totally non-intensive basis to get medical grade testing done every month with results back in people's charts and results back to the public health people by the following morning. Next slide. This is only part of our Return to Learn program. The Return to Learn program is actually comprehensive. We've undergone a very extensive and are still undergoing a very extensive mitigation study being led by Allison Sanders and by others, looking at what size classrooms we should have. Natasha Martin is modeling optimal classroom size, optimal dormitory configurations. We're looking at engineering solutions to plexiglass here and there, the kinds of things that you're hearing about with businesses to, when we do come back, have the lowest risk of spread should the virus come back too. The linchpin of all of this, though, is going to be vigilance. We want to plug up any holes in funding when people are infected in the current system in which we have most of our students, but not all of them, getting their care on the student health service. We have to prevent what was happening in the winter term when some students were showing up at urgent care and other places, living off campus, being tested, and us not even knowing that they were tested or infected. And certainly faculty and staff, many of whom get their health care at other places, could well have been infected and us not have heard about it to be able to do appropriate exposure notification on campus. So we want to plug that up and make sure that everybody who is tested, regardless of where they're tested, gets the information back to us as is being done currently in the hospital. The viral shedding initiative I've already mentioned. We want to make that very easy. The way we envision that happening is there'll be boxes of swabs pre-labeled by a barcode in boxes around campus. And by that I mean within residence halls, research buildings, classroom buildings, at hubs where people commute. All you'll need to do is we already have worked with IT and we have an app for that on a UCSD platform. You'll point your cell phone at the barcode that will link the barcoded specimen to you. And you'll swab either your nose or your mouth yourself, drop the swab back into a plastic sleeve, and then drop the plastic sleeve into a box next to the one you picked it up from. Then several times a day, those will be picked up and taken to the Calm Lab over at the hospital and run on the regular medical platform. Results will be reported in medical records. We're working on a way to do that for faculty and staff who don't have their care at UC San Diego. But our goal is to have it handled as a unitary program in which all the information will be flowing to one place. Then we'll be able to notify people as soon as we find out that they're shedding and be able to make sure that if they need medical care, they can get it either from us or from other places, and interface them with Cheryl Anderson and her group, who are doing exposure notification both for UC San Diego and for the county, so that we can use this early information to shut down transmission as best we can. Finally, we're also doing environmental surveillance. This will be looking in wastewater, looking in high touch areas, looking to see if there are places that we need to be, that we can either use to help us refine our viral shedding initiative, or that we'll need to clean more intensively to make this the safest place possible. We also are going to, as I've already said, when we find people who are infected, we have dedicated housing for students. We'll work with on campus that very much like what we operate in the winter term, where people can stay, have food brought to them, continue to participate in class. We'll work with faculty and staff to find, to arrange similar things at home or elsewhere with our public health partners. And then finally, this is set up to be highly adaptable. We are going to do something, this is unprecedented in many ways, and we're going to have to adapt from what we learn to try to make the pieces of it that are most effective, amplify those, and then we'll down ramp things that aren't helping us as much and try to make this as cost effective as possible. Next, now I want to point out this, go back if you will 1 second. This is going to require full university engagement. We want everybody to participate in this, both in terms of participating yourselves in the surveillance program and also helping us understand how to do it more effectively. Some people have said, well, I don't really want to have people finding out about this about me. All of the information that is handled from the standpoint of individuals will be handled in the medical context. And furthermore, who would not want to know that they're shedding virus they can take home to their kids or to their grandmother? What student would not want to know that they could be spreading virus in the dorm or in the classroom in a way that would cause us to have to shut the whole school down? This is really a safety program for us all to operate the campus in and to bring back our education and research as fast as we can. The last comment I want to make is that I see this as an interim step. We're currently using the Calm platform, and we want to continue to do this under CLIA conditions. There are a number of innovations, though, that are available to us on campus, and innovators who can bring, we think, even more highly cost-effective approaches to monitoring for nasal shedding. They're going to be working with people in the Calm lab to figure out how to scale this up to be used at clinical grade and clinical scale. And we hope to bring these technologies into the hospital to be able to offer those to patients and to our monitoring system, and to unleash the innovation on campus in a way that we can add this to our contributions to our safety and to society. So I'll stop there and be happy to entertain any questions or comments anybody has, or questions from you, Sandy.
Well, thank you so much, Chip. This really is remarkable. This is a one-of-a-kind effort in the United States to do such comprehensive assessment, testing, and to use new technologies to assist us in managing this. So we have about 10, 15 minutes or so to ask a few questions of Chip. And because this is medically based as well, we also have the good fortune of having Vice Chancellor David Brenner with us. So if there are questions that relate to either the coronavirus statistics that Chip talked about, what to expect, or this wonderful return to learn, and as I think about it, lurch to research effort, now's the time. So we'll open up the chat box for that. There's a Q&A button on the bottom of the webinar screen that you can use. And let's begin.
So the first question, Chip, is perhaps an obvious question, but are the testing processes being discussed only for people who physically return to campus? Or are there also expectations that people working remotely need to have some level of testing, especially before returning?
Now, our plan, this is going to be an ongoing program, so that as people return, they can be tested on campus. We haven't worked out some of the intricate details. A lot of this has been developing over the course of the last 10 to 12 days with a lot of support from people like Bob Newhart and the OSI, and from people in analogous positions on the health side. I would personally like to see it be something that all UCSD employees could take advantage of, because we all are often on campus, and have it really be a monitoring system that will allow us to detect shedding virus within anybody within our community. This also could be well seen, or should be seen by the county as a service to the county, because some of our students live on campus, but many don't. None of our faculty live on campus, and none of our staff do. And so we're going to be the most, I think, carefully monitored population within the county, and could well be a real resource for understanding what's going on with viral transmission around us.
This is David. Hi, there's a tremendous interest in the researchers, postdocs, technicians to be tested also when we ease the restrictions of research. So I really want to emphasize Chip's idea that we want to be very inclusive and really make UC San Diego as safe and as best understood as possible.
And David, one of the things we're going to need help from you and from Patty and from Chris and from all those who crunch data is to figure out a way to have all employees, all staff, all faculty have a way for us to get their data into a medical platform, either a medical record here or someplace that we can have the liaison with them be as easy as students. The only reason we started with students next week is we didn't have the information system solution yet for faculty and staff, but we will get it soon.
Excellent, thank you.
Next question is, does full university engagement include the SIO research fleet? Is there a way we can apply our COVID-19 tests on board our fleet?
Right now, there is a lot of work going on to develop EUA certified or CLIA waived point of care testing. And I think that one of the things that would allow us to be able to do some of that on ships, would be able to incorporate some of this technology as it comes online. There's some tests already that can be put at point of care, but they're going to be better ones soon. And I think as the fleet begins to go out, we should really work with Bruce Applegate and others to be able to figure out how best to do that.
Great. Is UCSD developing any apps being used, or will it be using the Google Apple processes?
Well, for simplification, I talked about only one part of the digital technology we want to use. The digital technology we want to use to identify and track specimens is one that has been developed in-house by Vince Kellen and Chris Longhurst and Bob Newhart, and it's our own. It's easy to interface that with other platforms. The other two parts of digital technology we need to think about are the contact tracing exposure notification part. Cheryl Anderson is leading that part of the effort, and she's been working with the county and with the state about what platforms they'll be using for that. There are several platforms that are currently vying for the honor to do that. I've heard most recently that Salesforce may be that particular platform, but again, this was information that was evolving yesterday and the day before. And we'll interface, the campus serology data in a way that, or I'm sorry, campus nucleic acid testing cases that are found with that system, so that exposure notification can happen in a seamless way. The other digital technology that is also under discussion is digital technology that may well come out of the engineering school, Cal IT2 and many of their partners, including places like Microsoft and Google and Apple. There are a lot of technologies that allow you to track cell phones, either understanding geolocations or understanding proximity, so that Bluetooth bumps are recorded. The value of this would be that if we can figure out a way to make this work, and we're working closely with both the faculty senate privacy group and with Pega Parsi, among others, would be that if I'm found to be shedding virus, and one of Cheryl's interviewers asked me who I was in contact with the last several days, right now it'd be very easy. I would just say Constance Benson. But when we're back to work, we would have to say, well, who did I have lunch with yesterday and who was in the lab? And this will actually help us, help people remember who they've been in contact with, and really accelerate the contact tracing, and also perhaps make it even more precise, because it'll be clear that we're going to want to be able to rank levels of risk in terms of how hard to chase individual contacts within the context of how much we have in resources. And if you've been with someone for 2 or 3 hours, that would obviously be a higher risk contact that you would spend more resources trying to run down and mitigate in terms of transmission. These apps are actually were used in Korea and in Japan, China, and we want to see if we could figure out a way to use some of them here to help us deal with the epidemiologic control as well.
Thank you, Chip. I'd just like to add 2 things to that. One, we are establishing a review process of which multiple apps are going to be used, so we can do really an aggressive comparison process here on campus to see what works best for us to help both with contact tracing and via some of the geolocation issues, kind of risk or hotspots, if you will, on campus. And the second thing is, Chip mentioned the contact tracing or exposure levels. And as we get to the research ramp up plan, you will see that we will need to have a way to know who is coming into a lab and who is leaving a lab. And that will give us additional resources in the contact tracing process. to look at the value of some of these apps. So Megan, next question.
The next question is monthly testing enough given that many students, staff, postdocs, and grad students off campus and may interact with many outside of the community? Wouldn't biweekly tests be better?
Daily testing would be best, right? What we have to do is look at the bottom of that curve and see where it's flat enough that if we spend money on hand sanitizers and other things, we're spending our money in a more cost-effective way. And we think that based on Natasha's modeling, that if we get to once a month, we'll be at a very flat part of the curve because we'll be testing the campus broadly. And that'll make it much easier to adapt how aggressively we go from there. If we start finding more activity, we can do more testing. But if we're at a steady state where there's not much activity, we may be able to get by with less testing. So part of the adaptability is looking at how much activity there is. We hope that as the costs come down, we can do more. And as that happens, then I think we'll figure out what the best approach is. I agree with the questioner because we think the virus, as it comes to the campus, will come from outside. It'll come from people like me on the faculty and people on staff who are out more than students who are living in the dorms and not going out as much. So we really want to have everybody be part of this program so we can really understand what's going on.
Great. Another question, Megan? I think we have time for at least one more before we lose Chip.
Sure. Chip, is there a concern about inconclusive test results in light of self-testing submissions and potential improper sample collection?
Well, we're doing two things along these lines. One is we're going to be putting together some YouTube videos to show people how to do it. We also know now that the testing that has been done medically, the additional sensitivity you get by coming back with neurons on the end of the tube by going back to your throat and a bit further is minimal. And that if people get up into the middle turbinate, the sensitivity is pretty good. The next thing I would say is that there is quite a bit of medical literature now in the peer-reviewed literature that salivary testing is awfully good as well. So one of the things I'd like to see us do over the course of the summer is see if we can validate that and be able to do salivary testing, which would be even easier to collect, and in a couple of the studies may even be better than nasopharyngeal testing. I think, as I said briefly, this is a great opportunity for us to do what we know works now, but also to innovate so we can make this faster, less intrusive, and less expensive.
Excellent. Thank you. Thank you. David, is there anything you'd like to share before you step off? Or perhaps he just stepped off. Okay. Chip, would you have time for one more question before we get
Sure.
rolling with the next part? Okay, thank you. I do know you need to leave, but I think there are lots of questions out there.
Chip, last question. Will employees be required to participate in this program, the Return to Learn program?
Right now, the plan is to have it be voluntary. I will say that this is a public health intervention, and it's not inconceivable that employers around the country, including even us, could make participation in monitoring plans mandatory. It's a public health intervention. It's not a it's not a research experiment, and it's not strictly a health care issue. From what I said earlier, I don't really see why someone would not want to participate if what they're going to be told privately by someone who is trained medically and sits down with them and tells them they've got coronavirus in their nose. I don't know why you would not want to know that from the standpoint of exposing other people that you're with all the time. So this is a bit different from testing people from diseases with more stigma and things that I certainly, as someone who's worked in this area for all of my career, I understand those issues, but this is a virus that any of us could get at any time, anywhere, from people who are shedding it and don't know it. And so I don't see stigma involved here. I only see safety and better medical care involved here.
Well, and we appreciate the care and the attention that has been placed in the arena of ethics and privacy in this process to ensure safety and confidentiality for those who of the information about those who are participating. And that is a key. It makes it more palatable for folks and more feasible for us to get really large portions of the population. So again, I want to thank Chip for taking the time out of his very busy schedule. This is such an exciting opportunity for UC San Diego to have a comprehensive approach to testing and to make empirically derived decisions about what is going to be needed to help this be a safer environment for students to return to, for faculty to return to, and for staff to return to. And certainly on the research side, it helps us lurch to maximum research to the extent that we can when we can incorporate these types of testing in the process. So thank you so much, Chip, and for the whole team that's been involved in developing this.
And thanks to all of you who keep our research engine running. It helps us all.
Very good. Thanks. Okay, so let's move on now to the next part of the research town hall. We're actually going to move past this. These are a couple of supplementary slides that Chip had, and to the next one, in fact, too. There we go. So before I talk about the process that has been used to develop the research ramp-up plan, I just wanted to take a quick moment and mention that we had a seed funding opportunity a few weeks ago, about actually almost a month ago, with a very short turnaround, and we had a good response to that. These were very modest awards geared toward attending to individuals who are interested in incorporating COVID-19 factors in their research programs, getting connected in a way that would afford them to be engaged either in understanding the etiology, the progression, the remission, the transmission, the impact of COVID-19 on people's lives. Those were the foci. But we did notice in the 24 applications that we had, there was very little diversity, either gender diversity or ethnic diversity. And we became concerned about that. So we have the good fortune of joining with the Vice Chancellor for Equity, Diversity, and Inclusion here on campus, and generating an opportunity for some new awards for those that were challenged in that application process. We think that there are some that for whom it might have been more difficult, particularly assistant or associate level appointments with childcare responsibilities or adult care responsibilities at home. And so we're going to create another opportunity with some additional resources from EDI and funds provided by the Office of Research Affairs for these small seed grants to get people started on COVID-19 related activities or helping to mitigate the impact on research or creative activities that are due to COVID-19. In some cases, they might be related to just restarting your research scholarship or creative activity quickly. And also for trainee research projects that might have been impacted, for example, by caregiving responsibilities. So we will launch this. I think actually the announcement is going to go out today. We've got almost 3 weeks before the deadline. And the thing that I want to mention about this is there's a very brief justification, just a one-page justification related to your applications. And for anyone who needs assistance in the administrative part of that, by contacting this website, we can do some work for you. Some of the administrative part by phone so that it minimizes the challenge for those who may still be impacted and probably are impacted by COVID-19 related challenges. So Miroslav Kristic, the Associate Vice Chancellor for Research, is heading up this, and there's the web link for you all if in fact you think you might be eligible for this. So with that, let's transition. I think it's a nice opportunity, and let's transition to what's happening regarding launching plans to scale up research here at UC San Diego. We have the good fortune of having a campus-wide committee that's working on this to develop both the process and how to do plans to scale up research as quickly as we can safely do that. This will be done in full alignment with the university's overall plans for scaling up activity. That is, there's an education continuity workforce. This is the research continuity workforce, and there's a staff continuity workforce as well. Our plan is a phased approach. It's not all or none, but we will, in light of the information that Chip has just shared, bring back, have the opportunity to bring back more research personnel and enhance our research activity in a stepped fashion. We will continue to make that commitment to work remotely if that is feasible. Now, why is that important for research? Because if work that can be done remotely continues to be done remotely, then that allows us, given what the density limitations or constraints are going to be, to put more hands-on people in the laboratory to actually do the work, or to bring people in for their clinical trial studies or human research or work with animals or creative or performing arts as well. And so we want to continue that framework that if you can do portions of the research offsite in your home, we want to continue that to maximize the those kinds of activities that could be ramped up that actually need to be done on site. There are different types of health risks associated with different types of research and the context of research. And it's the type of research and the context of research that will determine what the lab requirements and the office requirements will be. So in the next slide, I just want to acknowledge that Miroslav Kristic and Dean James McCarrow chaired this continuity of research task force. Many members of the faculty were on this from all parts of campus. There were additional faculty that served in an advisory capacity, as did staff and students. And we looked at a number of different areas and types of research, things that you might, challenges in wet labs with equipment or instrumentation or research service type projects, clinical trials, human subjects, animal research, field research, community-based research, performing and visual arts, and the libraries. That's not an inclusive list, but the point is that we're trying to look very comprehensively at the huge amount of research that's done in our $1.4 billion portfolio here every year. Next slide, please. California, the governor, has 6 indicators for modifying the stay-at-home order. And his stay-at-home order is one of the major constraints on ramping up research here on campus. Currently, we are in that stage, and he is saying, he has said that we need to monitor and protect our communities by using things like testing that you just heard about, contact tracing that you just heard about, isolating and supporting those that are positive or exposed. And as you go down the list, these are all challenges to us in our research ramp up plan to be able to actually bring more people here on campus or engaged in community-based research. Next slide, please. So what are the principles we're going to use? Things that relate to health and safety, of course, factors that relate to practical ethics the ethics of conducting certain types of research, given the risks that are associated with conducting those types of research. And we want to return to as much productivity as we can, as quickly as we can, and as safely as we can. So the process that you're going to hear about is a relatively simple process. We want it to be transparent. We need your input to make sure that it is in fact as easy as possible, not complex, require minimal enforcement, and that it's practical for you. So it's designed at a unit level, and that we will have lots of flexibilities because we may need to ramp up. We may be able to ramp up, but there may be times, as Chip was saying, that we have to ramp back. Next slide, please. So there are some obvious standard rules we're going to use. If people feel sick who are at the work environment, or they suspect exposure, we are going to ask them to work remotely, and we're going to ask them to be tested. Those that are on site have to adhere to the CDC guidelines that we make explicit in the plan, and to use appropriate PPE for the context in which they're operating. In almost all cases, I think in all cases, this will require face coverings, but the type of which, whether it's a mask, a face covering, what type of mask it is, will depend on the type of research and the context in which it's done. Few types of research will require N95s, masks, for example, but others might require masks or face shields rather than simple face coverings. We will expect that there will be a sanitation, a cleaning, wipe down process before you begin any shift, any entry into the laboratory, and when individuals leave. Additionally, we're talking with EH&S about what are the cleaning requirements and what will they be doing before you get back into the lab in situations where labs have not been used for a period of time. Physical distancing will be part of the plan, and I'll lay out what the contingencies are. And again, if we can do work remotely, we will. I want to reinforce the notion that students and staff are not to be pressured to come to work. If there are objections, we will have a process to address those objections. And then finally, we don't work in isolation. We work on floors where other people are working. We work in buildings where other people are working. And so the plans for the ramp up will go through department chairs and through deans to be sure that all of that type of thing is coordinated. Next slide, please. So as I said, there are context specific requirements. We've got work groups in each of the areas, and there are just some examples here. If human research is going to require some screening before you actually are face-to-face with anyone. That's whether you're in a clinical trial or you're in an observational study. Wet labs are going to restrict people to a certain number of folks per aisle or per bench, and community-based research is going to have some traveling restrictions. These are just examples. I do want to say to everyone that's on the phone or on the webinar that if you want to ask for an exception to these requirements, there'll be a process to do that. You can submit that, but the approval will be contingent on a mitigation plan to manage the risks. And again, that'll go through the same process with department chairs and deans as the rest of the plan. Next slide, please. So what can we be doing now while we're getting ready to open up to a slightly greater extent for research? Well, we are in the process of seeking acquisition of the PPE and sanitation materials to make sure that those are available for research labs as they get started. The PIs and their staff will be preparing an on-site plan, including things like density, management of the density requirements, the sanitation requirements, scheduling. You might have you might have a morning staff and an afternoon staff, for example, or you might have a Monday, Wednesday, Friday group and a Tuesday, Thursday, Saturday group, so that you can maximize the number of people and projects and activity that's going on. We are going to ask that everybody that comes back into a research setting, whatever kind of setting that is, that they review what the requirements are for that setting, and they agree to that. That's important so that the PIs can hold their staff and the students accountable, and the department chairs will be because the department chairs will be holding the PIs responsible. Finally, we want to do as much creative planning as we can within the unit. So if you have ideas, other ideas about how you can maximize the scale up of research and creative activity, we really would like to hear from you. Next slide. So the design of this plan is consistent with most of the designs for universities across the country. Some have 3 phases, some have 6 phases. All the University of California campuses have 4 phases. We've labeled them red, orange, yellow, and green. Red's where we are now, right? Because it's the most restrictive. We are in that essential research only, shelter at home mandate from the governor. But as we are thinking now about shifting, where we can have some low density with safety precautions like PPE and distancing and sanitation, then we'll be shifting into the orange phase. That some aspects of the shelter at home requirement have to be lifted, and it is our understanding that that should happen in the near future. And then there would be a yellow phase that would be further lifting, and then finally back to full engagement in research activities, although there may be some changes there. So there are, oh, back please, thank you. So there will be safety and sanitation requirements. There are going to be density requirements. There will be a process for the researchers to complete that attestation, that they understand the what's expected of them in the lab with this greater activity. The PIs will need to fill out a plan that will need to be reviewed and approved by the chair or center director and by the dean to ensure that we are all working together appropriately and consistently. I will say that's also important for those of you who have joint appointments. Your application will go, or your plan will go, as your original ramp down plan did, to both of the chairs for which you are, through which we have your joint appointment. And then finally, there will be triggers that for each of these phases. As I mentioned, one of the first ones, which has to do with some type of modification so we can scale up, and we're expecting that from the governor. But above and beyond that, I want to make it clear that these are done in conjunction with a university-wide plan. So ultimately, the emergency planning group on our campus, led by the chancellor, will make a decision about when it is okay to make a transition. And of course, he will consider alignment with what the statewide requirements are and the local requirements are, but what is relevant to our campus. So it is our goal to increase research as quickly as we can within these safety guidelines, and also within the concerns that Chip mentioned about a resurgence or potential increase in the COVID-19 later this year. Next slide, please. So what's the process? Prior to getting started, you need to be thinking about what your plan can be given the limitations or restrictions that will be in the guidelines that are coming out at the end of this week. The PIs will submit that plan to the department chair or their division heads, and then on to the deans, or in health sciences, the department chairs. Everybody completes that agreement. We're going to have EH&S take care of some of the startup sanitation issues, and we need to be sure that we have the PPE and sanitation supplies in place. Then with the on-site activities, PIs will be responsible for, researchers will be responsible for their density restrictions and all the things that are part of that plan. Nobody's going to be a policeman. But if we receive reports, and we have in this last phase of inconsistencies, then they will be actively evaluated. It's our goal to allow as much research as possible. It takes a lot of coordination, and we're counting on everybody to be able to move forward in as quick a fashion as possible. Next slide, please. So I wanted to mention that we have work groups by various types of research and that already have outlines for these various types. And this is what's going to come out on Friday. Next slide, please. And again, these are the kinds of things that we're currently doing to make sure that within the next few weeks, we're going to be able to ramp up. But we do have to have some things in place. We have to have plans for common areas. We have to know if there's an exception to the density request, how is that going to be maintained? If there's any training required, how is that going to be maintained? And as I said before, we need to have the PPE and standards for each of these various assessments. If you're doing a research imaging process, for example, if it's animals, how is that managed? If it's humans, how is that managed? Is that the same as clinical imaging, et cetera? And so we need to have all of those details so that we can, in fact, ramp research up in these various areas. Next slide, please. So I think with that, I'd like to stop. We have a lot of people on the phone who can answer questions that might be related to the ramp up plan. And again, you can use the Q&A button at the bottom of the webinar screen for that. And we also have listed for you a number of resources to answer many questions that you might have. There are things that are already in place. We certainly, on our COVID-19 point on our Blink website, for example, we have information, and from there you can get to animal care, the IRB, OCGA, et cetera. But these are all resources for you. I'm sure some of the questions will have to do with human resources. Some will have to do with environmental health and safety. So these are resources, and we'll leave this page up as we start to address questions. So with that, Megan, why don't we start with the first question?
Okay, the first question, is there a fixed date when research activities are going to resume?
Yeah, there are a couple of UC campuses that have designated a start date. We are going to wait until we hear from the governor about the nature of the changes in the shelter in place plan. We have some ideas about what they will be. So our announcement will be a little bit later, but most of these are going to occur in approximately 2 to 3 weeks. And that's what our target is as well. So we would anticipate by the end of May that we would be able to see some changes. So of course, what that means is we will make changes contingent on your research plans being in, scale up plans being in, and approved.
For research activities that can be conducted remotely, how long should staff anticipate that the quote, work remotely when possible rule will be in effect? In addition, will there be a formal communication that goes out to staff with this guideline? I think you already touched upon that. Sorry, I'm reading this as we go. Some individuals in my department are expecting a sooner return to in-person research. Setting date.
So as I said, one of the things that is going on for the plan for research is that it's linked to the education plan and it's linked to the staffing plan. So there will be a formal announcement for all staff that will help us know what the guidelines are for scaling up. With regard to the initial question, which had to do with will we continue with this if work can be done remotely, should it be done remotely, and when might we be able to return? I think there will, for safety reasons, until we can have everyone tested. We are going to be encouraging people to work at home if the work can be done at home. You know, I don't want to speak for HR, I don't want to speak for the academic units, et cetera, but I think there is a general understanding that we want to ensure safety. Part of the reason for doing this massive and aggressive pilot project over the course of the next month is so that we can determine how to make it safe for people to come back to work, or safer for folks to come back to work, and what would be our plan for that. So there will be an announcement, and we will be cautious and encourage people to do work that can be done at home until we have a plan to ensure on-site safety.
Okay, thank you. Will the university provide PPE or sanitation materials, et cetera, to the labs, or will this be at the cost of the individual labs? Can these be charged to grants?
Excellent question. In fact, we are querying about the specificity of grants right now. But quite frankly, I'll start with the grant side first and then go back. If we can scale up research, and what we need is PPE and sanitation materials, we want to get that to all the labs to be sure that they can launch. We do want a centralized process for procurement so we can get more of these materials faster and at a lower cost, because we do anticipate if this is going to be a requirement for you to do your research, you should be able to direct charge that to the grant. And we can talk more about the details of that later on. But initially, we don't want that to hold up any work in any setting. And so we are in discussions now about how to ensure that we can start up and not be hindered by the need for PPE. We certainly heard a lot about PPE needs nationally, and I want to thank all of the researchers at UCSD who made important contributions to PPE to our clinical care providers early on in this process. And now it's time for us to get PPE back in the lab, and for those labs who have not used that before to have those materials available. We will expect, as I said, though, in the long run, if you could charge those to your grants, then you will.
Thank you. For the orange phase of scaling up, will students be allowed to return to laboratories, or does this only apply to faculty and staff?
Yeah, so unfortunately, Jim Anthony wasn't going to be able to be with us today, the Dean for Graduate Students, but I have had discussions with him about this and with the Vice Chancellor for Student Affairs. So there will be no restriction for students. So undergrads, graduate students, and postdoctoral scholars can come into the laboratory. We want to make it very clear, however, that they cannot be pressured to do that. There can be no coercion. And if they're uncomfortable, as is the case with our staff members, we need to figure out a way in the individual labs to deal with that issue. I think this is very important because for graduate students, they have a limited amount of time to complete their research projects. For postdoctoral fellows, for honors projects, culminating research endeavors for the master's level students as well. And we really understand that there are those time pressures. So we want to get students in the lab to finish their their projects if they're willing to do so, but never pressure. And I would make one other comment here before moving on to the next question. And that is that additional support for graduate students and for postdoctoral scholars is a priority for our campus. And we are really pushing this for additional federal funding to do just that. We've had discussions with a number of agencies, with the House Science Committee, and we are encouraging that for all postdoctoral scholars, there be an automatic funded 1-year extension. And for graduate students, final year for graduate students, that there be a 1-year extension for them as well. They've been put on hold in terms of their research, and we are very hopeful that in the next tranche of funding that we might get from the federal government, that this could be a key and clear component of that funding. There is no guarantee, but I just want to assure you that we are making every effort to make that point, to make sure our delegates know, that the appropriate appropriations committees know about this, and that the Office of Science and Technology in the executive committee to the President Trump knows about this need and priority as well. We're working with national organizations like AAU and APLU to see if we can get this listed as the part of their priorities as well. So we're making a massive effort to try and do this. And this is, from my perspective, something that we can do that can help researchers all across campus. And quite frankly, this would be regardless of whether people are on training grants, they have individual fellowships, or they are simply listed in one of your individual awards or a center award. So regardless of how they're funded, if they are funded from federal funds, we are asking for a 1-year extension.
Okay, next question. The phases of scale-up slides show density restrictions that do not appear to address in-person testing or MRI imaging options for human research, given typical sizes of testing rooms and the size of the MRI console room and so on. Will this be in the same vein as wet lab persons per aisle, such as 2 persons per room for such conditions?
Yeah, this is a wonderful question. And this is, I think, why we had so many work groups for the research continuity plan. What we articulated, I think, in the table was simply wet lab and general office space. But the demands vary markedly. And in fact, we have a process going on right now to ask advice from those individuals who are the experts in imaging about what should be the safety measures to be taken and how to manage those challenges of human research. When should you be able to do face-to-face research? If you're doing interviews, for example, or you're collecting biosamples, but are doing so outside of the medical context, if you're doing it inside the medical context. So by Friday, you'll see much more detail, and it should reflect the contextual and research type variability that is being referred to in this question. I will just pause here and say if either Jim or Miroslav would like to add anything to that response, because
just to assure the person who asked that question, which I think is a very good question, there were separate subcommittees to look at wet lab space and the density for wet lab space. That's one thing. and a separate subcommittee that looked at major equipment instrumentation, which would include MRI facilities. So indeed, there were people who were involved with major instrumentation who understood it, and they had a separate set that you'll see on Friday, a separate set of recommendations.
Thank you, Jim. Miroslav, would you like to add anything?
No, nothing. I think it's been answered. We just set up today one additional subcommittee for neuroimaging, and they're also going to be looking at MRI. And I'm guessing that the answers to this question will be forthcoming from this committee. There have been related questions about work with the human subject and clinical trials, to which I think the answers already have been given in the draft report with respect to the management of density, the handling of waiting rooms, pre-screening, the protection of human subjects and so on. So all of this is being addressed.
And I would like to, at this point, just extend a thank you to our IRB review committees and leadership in the IRB, Kip Contello in particular, for the flexibility that they've shown with regard to the human subjects research that's carried on campus, because there's such a diversity of types of human-related research that we do.
I'd like to also say that as the questions are coming in, every once in a while, I spot something that I have not seen addressed. And I hope that either Megan or somebody else administratively supporting this town hall is recording the questions, and we will triage them back to the subcommittees for more input and consideration. Because some of the attendees to this webinar are coming up with scenarios that I have not seen considered in some cases.
Yeah, thank you for saying that, Miroslav. I do want to highlight that one of the reasons for doing this town hall is to be sure that you know where we are in the process. You know what you can do to get ready to ramp up our research, and also to get your feedback on the framework that's being discussed. As I said, on Friday, we will have the first version of our guidebook for research ramp up. We are considering this a living document, so that as you observe new challenges or you have new creative solutions, our goal is to, at least for the next month, to be updating this on a weekly basis based on your thoughts and your feedback. So we're really encouraging you to do that. And we will, of course, take the questions from today that we don't get to and have them addressed. So thank you. Megan.
Sandy, if I may add one more thing. I've seen a number of questions that maybe I can try to answer with a catch-all answer, and they relate to a whole host of issues, including remote work and related things, and the people from vulnerable populations and so on. Chip Schooley's slogan, "Lurch to Research," may not have been accepted by the communications department, but I think by popular demand, it's being really embraced, and it captures the spirit of what we're doing. But the spirit of the planning is not. It's really lurch to research. It's not lurch to how it used to be. So there is no lurch to getting everybody back on campus. Remember, this is all about the management of the so-called R0, keeping R0 relatively low. So what's at our disposal are a few tools like social distancing and PPE and sanitation and so on. So we're trying to get back to the research that is the highest priority and not back to normal. what the highest priority is a very complicated question. And the answer, the most qualified to give that answer is the PI herself or himself. The importance may be measured in when the deadline for the next grant is, or the submission of a paper, or somebody's graduation, and so on. So this is why the plans that are going to be coming up will be based very much on the specific circumstances of that PI. With some additional things, the PIs should be reminded that there is one more factor in all of this, the human factor. Everybody should enjoy the benefits of some discovery every once in a while. People should be coming into the lab occasionally, even if they're not somebody's most important staff member for the next immediate grant. That aspect should not be forgotten as we work with young people who've been in 100 square feet the last 2 months.
Thank you, Miroslav. I do want to say again that being creative about how you structure your return plans or your scale up plans is important. And this is where even if people are coming in shifts, you might have people in the morning or the afternoon or different days of the week, that just for the coherence of the research lab, we would encourage ongoing meetings of all staff in no less than the frequency you had before. And one thing that's been observed by in large companies of this type is that more meetings rather than less meetings when you're working off-site is valuable in ensuring adequate communication, because we don't have the incidental communication that you normally would have just by being in the same place. Good. Megan, want to move on?
Yes. When can we resume recruitment and hiring of researchers such as fellows and staff? And are we allowed to fill positions opened when a staff member leaves?
So if this is, I'll speak with regard to funded research projects. If your funded research project affords you the financial circumstance to be able to fill a position, you can fill a position. There's nothing about the current hiring limitations at the university that have to do with separate types of staff positions here on campus. If your research grant affords you the funding for particular positions and someone leaves, you can replace them. It's the same standards that we've always applied.
Okay. Next question. What is the plan to handle incoming postdoctoral scholars and graduate student hires from abroad and across the nation that are now in limbo or were supposed to come during the lockdown?
Yeah, this is, again, a very important part of our research program, is it not? Because of visa limitations and other types of issues and apprehensions about what classes will be available to graduate students or postdoctoral scholars, there's been considerable discussion, and this has been partially one of the foci of the education continuity plan. So we're making every effort to make available opportunities for external postdoctoral scholars and graduate students, with the understanding that courses in the fall may need to begin to be delivered remotely or virtually as opposed to in person. And but one of the reasons again for the study this summer is that if we can create the contingencies that would allow more people to be back on campus, then we can do some of these courses in person. I don't know if Judy Kim, who I believe is on, has anything to add to that from the graduate division. Judy?
I do not believe she was able to stay.
Okay, okay. So, so I guess that is really more of a question for the Education Continuity Committee. I do know that for for postdoctoral scholars and visiting scholars, we are establishing criteria to allow them to come to campus under the right conditions. The challenge, of course, with foreign scholars is the visa limitations and travel limitations that are currently in place. From our perspective, if a graduate student is a non-California resident and planning to begin this fall, every department is making aggressive plans to try to fulfill those commitments to those graduate students. How much is going to be offered on campus versus virtually is currently under discussion, and we're trying to be as flexible as possible, including what's being referred to as asynchronous courses. So if the core courses are taught here in this time zone, they would need to be available at appropriate times in another country as well. And so there's a massive effort to ensure that. We're hoping that we will have a bit more definition, both about the undergraduate level and process for classes and the graduate level for process of classes over the course of the next month.
Sandy, I just want to raise a question that has been raised in response to the discussion of student activity.
Yes.
Over the summer, all student educational classes have been set up to be done remotely. And that leads to the conclusion that student researchers are not required to be on campus over the summer. You said students are allowed to be in the labs even at this time during orange and yellow. And so could you either acknowledge that this is a disconnect we need to discuss with our colleagues over in academic affairs, or help thread the needle for us?
Absolutely. Certainly we'll take a discussion back to the education continuity plan. And it is the case that all summer courses are offered remotely, whether they're undergraduate or graduate level courses. So thank you for that clarification. So that said, we do have 5,000 students that are on campus, 3,000 undergrads and 2,000 graduate students. So for those students, if they are here and can participate and want to participate and are part of your research scale-up plan, then that would be permissible. We should not limit their involvement if it's appropriate from your perspective. But we cannot require, we should not pressure, and we cannot coerce students who are UCSD students at any level to participate in the lab. And that would include requiring that they come back onto campus if that's not feasible for them. Thank you, Faith.
Okay, Sandy, the next question is, will there be templates available for the various requests and agreements that have been discussed?
Oh, wonderful question. And the answer to that is yes. We're very close to final forms there. And Faith, do you want to say anything about that? Because I know you've been working on that with ITS.
Absolutely. We are working on an online way of you inputting information and telling us who needs to be on site in each of the phases. So when you do it this time, you won't have to do it again when we switch phases, nor if we go from yellow back to orange, would you have to do it again? You will just sort of lay it out and then only need to make changes if your personnel change. Those forms or that online tool will be available in next week, hopefully in the middle of next week. But we want to make sure it works right because it will automatically route to your department chair for approval. It will automatically route to your dean for approval. And so it will be a simple process once we get it right. We will also have available as downloads from that, which you can fill out and upload. Templates for the different agreements, for looking at your floor plan, et cetera, and so forth. So additional guidance. Specifically for screening processes for human subjects research and clinical trials, that will be available through the Human Research Protections Program.
Good. So I think we're trying to set this up in a way that makes it easier for researchers and for staff. And as I understand it, an administrative aide can assist a PI in filling out the plan. We want these plans to be PI determined because they will have to make priorities about who is in the research context and how things are going to be sequenced, et cetera.
Absolutely.
But it would be very nice to have floor plans available for you to look at as you're making those decisions. And this gives us, again, a record that security can use. If there are ever any problems, they'll know who should be in the building or the space to protect our research spaces. And for EH&S, if there are challenges or concerns, or for example, as we begin contact tracing, to know who would have been in the laboratories over the past week or 2 weeks. So all of these things can be helpful for other parts of campus as well.
Next question. How can we ensure safety using bathrooms and other common spaces during the workday?
Excellent. We've been speaking with facilities and with EH&S about this. And there will be standards for using and negotiating hallways, common spaces, kitchenettes or dining spaces that are available in laboratories as well. Do we have Lance on the line today?
Yeah, I'm here.
Yeah, Lance, would you like to say anything about this matter about common spaces?
Yeah, I agree with everything Sandy just said, that we're trying to pull together the guidelines and helpful tools to get people through this process for getting into tight quarters, hallways, bathrooms, and that. The biggest is going to be washing your hands frequently, face coverings when you're out into these public types of areas and that. So it's really going to be the same standard processes: routine disinfections, hand washing, face coverings, and social distancing.
And one of the things we're going to be asking, Lance, is that we have enough signage up so that it's easy for people to know what the standards are going to be and what resources are available. For example, we want everybody to know where sanitation materials are, and if there are any common things provided in common spaces where those are located. We want that to be easy for our researchers, our staff, and our students. Thank you. Appreciate your help with this.
Next question. Are there any plans to enforce temperature check at the entrance of all research buildings, similar to what is done at the hospital or the VA?
Yeah, this is one of the final issues of discussions with CHIP, Cheryl Anderson, et cetera, and with that team to determine what are, in the interim until we can actually have regular testing, what will be the requirements. At the present time, our expectation is that we will ask questions that are related to the CDC symptom checklist. The actual temperature gauging, we're not sure about that. And I thought we were going to recommend that, but I think that there is a question about whether we need to do that. And one of the reasons is, as Chip was alluding to, that people are often shedding virus without being symptomatic, and certainly without having a fever. So we're in the process of discussing this, and I do believe that by the end of the week, we'll have those requirements for coming back into the lab very clear and well specified. Anything that we talk about for coming into a lab, coming into a performance setting, coming into some kind of office space on campus means that that's going to be a standard, not just in your space, but in all other spaces as well. What does it mean about students who are coming into classes? What does it mean about administrators who are coming into their offices, or staff who are coming into their offices? So we want to be very consistent, and that is the reason why we don't have all those details finalized, but we do have a commitment to have those totally agreed on by the end of this week.
Time for one more question, Sandy?
Sure.
Okay. The subject of this question is consequences of the COVID-19 virus. What is being done for recharge facilities? These will certainly incur debt due to the shutdown. There should be a plan for a long-term recouping of losses, and no recharge facilities should be required to let employees go due to the immediate debt situation.
We are particularly sensitive to this issue. It's been raised a number of times at very senior levels. I've raised it myself, as have other leadership on campus. So we are working toward a resolution on campus, but probably more importantly, part of our federal priorities are making research programs whole. And that includes recharge services and the critical infrastructure that we have here on campus. So that is a key part of our efforts nationally and our advocacy efforts. I think we do have Angela Phillips Diaz on the phone. And Angela, I wonder if you might like to say a word about this before we close today.
Sorry. So
okay.
Yes, I mean, we're very committed to our outreach and engagement with the congressional and with the agencies. I think there are 3 points to make. One that Dr. Brown has focused on is a lot of attention right now has been on COVID and ways to engage our faculty and addressing the needs of our graduate students and postdocs, which is a high priority. But we don't want to lose sight of all of the agencies have their ongoing activities in your different fields and disciplines. And so the agencies are trying to maintain the standard course of activities and solicitations and opportunities, whether it be through fellowships or training opportunities or internships even for students. So we want to make sure that we are following those and being responsive. And then the third point is we are in the process of the fiscal year 21 appropriations. And so although the Congress is still sorting out their schedules and activities, they are continuing that business so that when they do return, they are going to mark up bills and proceed. And so we, and with our colleagues from the professional associations, are working very determinedly, I'll say, to ensure that we achieve, if not at least the fiscal year 20 levels, but more strikingly going for increases as we have advocated. We have to be mindful that the world's different now than when we submitted proposals at the beginning of the year or last year. But we have a strong support from our direct congressional delegation in the San Diego region and our two senators, and they have signed on to a number of dear colleague letters going to leadership and decision makers relative to whether it be support for NIH or NSF, Department of Energy, Department of Education, and other activities. So we are fortunate. We've got strong support, and our leadership with the chancellor, the various vice chancellors, deans, are very active and engaged. And so we just want you to feel confident. We will and have called on a number of you on specific needs to engage with congressional staff or members, and that will continue. And it does make a big difference. So we're grateful for that, and thank you for that. So that's it, Sandy.
Thank you for your advocacy, Angela, and for keeping us in the mix of that decision-making. It's really important. Before closing, I want to say that all of the questions that you have raised, we will review those, try to cluster them in ways so that we get them on our Q&A on our Blink website. So please look for your answers. If we didn't get to your question today, look for your question and the answers in that format. And any advice that you've given us in that context, we appreciate it. And any additional thoughts or advice that you'd like to share with us, we certainly welcome that as well. Want to thank all of the researchers, the staff, and the students that joined us today in this good discussion and candid discussion. And we are always open for questions. So I thank you all and all of those who are on the phone to serve as resources to be able to have these direct conversations. I think we're planning on having the next one in 2 to 3 weeks. That will be around the time that we'll be ready to ramp up. So look for an announcement next week about filling out your plans and for more details related to the research ramp up. Thank you, everyone. Bye now.